Good afternoon, everybody, and thank you for joining us for today's webinar on how to communicate compassionately with clients affected by baby loss. I'd like to introduce myself. I'm Michelle, a marketing manager here at INNEG. I'm sure by now many of you know who INNEG are, but you may not know that we have recently rebranded and relaunched our new website. You can now search our database to see how many experts we hold in a particular area before getting in touch for nominations, as well as accessing all of our previous webinar recordings via our new resource centre. We've also just launched our brand new events page where you can see and register for new and upcoming webinars and live events, plus an ebook library so you can access our free downloadable resources on key medical legal topics. So yeah, please take a look when you get a chance. So moving on to the main event, we know that communication is vital in all walks of life, but especially when it comes to birth, injury litigation and supporting those families. I'm therefore delighted to introduce Katie Monk from Angels United. Katie is a bereaved parent, advocate and educator who trains NHS midwives and healthcare teams on how to communicate with grieving families. She'll be sharing her lived experience and professional insight into how solicitors can communicate with compassion to provide the best possible support to clients affected by baby loss. Katie will now take us through her session, and afterwards we'll open the floor to your questions. If you can think of any questions in the meantime, please drop them in the Q&A or the chat section and we'll pick them up at the end. And with that, I'll hand over to Katie.
Thank you, Michelle. That was a really nice introduction. So yeah, for those of you who don't know me, I am Katie, and I am really excited to be joining you today for a topic that is really, really close to me. It's something very personal, and it is a very important week. Today marks the start of Baby Loss Awareness Week, which runs from the 9th to the 15th of October annually. The presentation that I will run you through today has got some snippets of my personal experience of baby loss, along with some national statistics. There could be a few discussions in this that people may find upsetting, particularly if it's something that you have gone through personally. So if anybody would like a little bit of extra support, please do let me know towards the end, or please feel free to get in touch with me personally, or if you want to have a little bit more information at any point, please do just let me know. I have done some additional work as an NHS training coordinator and a charity co-founder since I became a bereaved parent almost 6 years ago on the 13th of October. So it is coming up to quite a special time for me and my family as well. I am very passionate about the education on the best ways to approach these difficult discussions that we can sometimes dread, no matter how many times we feel like we might have been through this, or if we spoke to people who have had a bereavement before. And this is something that us bereaved parents, we need the most at the times when we require it. So I'd like to just take you through a little bit about me, a little bit about my family, and how we found ourselves in this really sad situation, and a little bit that we do. So some of you might know me as an analyst here at INNEG. I've been here for 13 months now. It's been great, and I've built up some really great relationships in that time, learning plenty along the way. Within that time, I have looked after quite a few inquiries and helped my colleagues on some inquiries as well, where we have sadly had a loss of a baby or babies in that inquiry. At first, I was quite concerned that this was going to be really triggering, and it's something that I spoke with my superiors about, but instead of worrying about it, I found that actually I was able to use my lived-in experience, and that I was able to make suggestions, particularly around the type of expert or a particular expert with who had a specialist interest, that have helped me or others that I know along the way. As a result of this, hopefully some of those claims have progressed really well, and we've managed to provide a little bit of extra support to the parents who need it at that time. And hopefully this has also helped the solicitors and the people behind the claims. My husband and I, Ollie, we have had numerous miscarriages. We've had around 5 that we know of. Whilst these have been incredibly upsetting and challenging, they were quite early on in our pregnancies, and we do have an incredible little girl at home now. We are very lucky to have had our rainbow baby, Orla. However, a year before Orla was born, we had a stillbirth, and I will come on to the terminology around why miscarriage and stillbirth is very different to me personally, and why it might be different to some of those in your care and who you will be looking after on their inquiries. But we had our twin daughters, Poppy and Dottie. They were born on the 13th of October 2019. Now, we were quite lucky in the sense, and I use lucky as a bit of an odd word, as I know that that is quite unusual to use in a sad situation, but we had a reason for why Poppy and Dottie died. And it was something that we could almost pre-plan for, as unfortunately our prognosis during pregnancy wasn't great. And Poppy and Dottie had something called twin-to-twin transfusion syndrome. Now, I won't go into the science of all that because I will probably bore you to sleep, and hopefully that's not what we want today. So we were able to sort of prepare for our loss. However, when they were born at 23 weeks and 6 days, it still hit us incredibly hard, and we still had to then face our new reality of living life as a bereaved parent. Since then, we've become incredibly passionate about providing real and honest insights into the lives of bereaved parents. We sought some support and we were met with clinical advice rather than compassion, and that's where we thought there's a huge gap in training for people who provide this bereaved support. And I use the term support loosely because it is incredibly clinical. And what we actually need is person-centered care. And that now, I think, expands way beyond the hospital, way beyond the doctors, way beyond the students, and way beyond the midwives. It actually extends to all of you guys who will be looking after bereaved parents at such an incredibly emotional and vulnerable time in their lives. Because I felt like I didn't have enough to do, so I had a grief journey. A year later, I had a newborn, I had a new job, and I thought there still needs to be more. There still needs to be more for us bereaved parents, and what can I do to help that? So my husband and I have set up 2 organisations, one of which we are now charity registered, one is in the process of. But our registered charity is Angels United, and this focuses on the mental well-being of all family members, but with a specific focus, excuse me, on male mental health and dual parent care in the immediate aftermath of loss. Unfortunately, there is a gap, particularly for dads, and they don't often get the support that they need. So I'll talk about that a little bit further on in this presentation as well. So the work that we do alongside our actual jobs, we offer peer parent support. We were incredibly unprepared for our hospital stay, and I know that's a little bit of a contradiction to what I said, that we were able to prepare for our loss. We knew that it was likely that our twins were not going to survive beyond birth. However, we didn't know when their birth would be, and so I was unable to prepare like any expectant parents do. I wasn't able to pack a hospital bag, and I wasn't able to do all the things that we would normally expect excited parents to do in their preparations for birth. Because we suddenly went into labour, I had absolutely nothing on my person other than the clothes on my back, as did my husband. And during that time, it was an incredibly traumatic stay in hospital. We had nothing that would help us feel slightly more comfortable while spending precious time with our daughters before we had to say our final goodbye to them. It did not sit right with me that the incredible bereavement midwives who were looking after us after working 12+ hour shifts were then going out of their way and spending money out of their own pocket to buy me a toothbrush because I desperately wanted to brush my teeth, or the lady who went to her own house and got me some flannels because I desperately wanted a wash. And if anybody's ever been in a hospital, you'll know that the towels there are like sandpaper. So one of the things that we decided that we were going to do was we were going to help these hospitals who are sometimes stripped for funding and time and staff, as we all know. And we developed the Little Comforts Trust. This is in the preparation of becoming a registered charity. However, we provide small personal boxes, individual packs of essential hygiene products that hospitals wouldn't be able to provide. So we provide things like tissues, miniature shampoos, conditioners, etc., so that parents, whilst they're in, most hospitals have specialist bereavement facilities, and whilst they're in these facilities, they are able to hopefully feel just a little bit more normal and hopefully have just a little bit of feeling like themselves in what is such an incredibly emotional time when it's hard to remember to look after yourself. This is how we help parents doing that. Through Angels United, which is our CIC, we focus specifically on men's mental health. Angels United was founded in October 2020, and it is a peer-to-peer support group for dads and other family members to join together and play football whilst being surrounded by others who understand the loss. My husband is a typical football lover, but he also fits into the old adage of men don't know how to share their feelings. And whilst that can be a point of contention and frustration for a lot of people, there was genuinely a lack of support for him that felt it suited him and his needs. So by founding Angels United, along with 12 other dads, a safe space was created where football was the main focus, but where any thoughts and feelings were openly shared amongst peers without fear or judgment, without any of that stigma that seems to still be attached to men's mental health. This has now expanded to over 50 family members. It's not just dads now. We have grandparents, we have brothers, we have cousins, we have uncles, aunts, and we all join together. There's over 150 families supported in its 5 years and counting, and it's something that I am incredibly proud to be a part of, and I know that this will long continue. The final amount of work that we do is something that I'm hoping to share with you all today, and that is our education through experience. We were first invited to chat with student midwives at St Mary's Hospital in Manchester, and we were asked if we would share an honest experience of our loss, both good and bad. Sharing our experiences of early miscarriage, along with the stillbirth of our twins Poppy and Dottie, it allowed us to give a true and honest insight into the care that we've received throughout these losses and the importance of the words that were used by all the care providers. I can remember some of the words that were said to me even 6 years on. And that's why this session today will focus on the words that we use and why they are so important and why they're not forgotten. We've since expanded these sessions to other hospital trusts, mostly within the Northwest, although we have been invited to some in the South, which is really exciting. And we're now including, alongside student midwives, we're now including these to discuss it with obstetrics, gynecology and fetal medicine experts, all of whom often deal with parents prior to the bereavement and not afterwards. But in dealing with us as a training session, they're able to prepare for when they might be able to have to deal with a bereaved parent. So before we get into the importance of the language, I would really like you to take a moment to just consider the statistics. These might be statistics that you are already aware of. They might be something that you find quite shocking. They might be something that you find quite realistic. All of these have been sourced from the Office of National Statistics, and they are available for anybody to view at any time. Some of these could be disputed because the true number is unlikely to be known. Not all of these will be recorded, particularly early miscarriage. Unfortunately, not everybody feels they are able to gain treatment or has the ability to gain treatment. And so these don't always reflect the true number. But of those that we know that 1 in 5 pregnancies currently end in miscarriage, which at the moment equates to around 250,000 a year. And I personally think that that is an absolutely huge number. And this is just UK based. This is not international. An early miscarriage, which accounts for 10 to 20% of those, is a loss that happens between conception and 12 weeks. A late miscarriage between 13 and 24 weeks accounts for 3 to 4% of miscarriages. Ectopic pregnancies, which occur approximately 11 in every 1,000 pregnancies, but we are seeing that these are happening slightly more often. I don't know about the inquiries that you have received, but I've certainly spoken to people who have experienced an ectopic pregnancy and has had to have some incredibly traumatic treatment in order to recover from that. Stillbirth, which is categorised as loss after 24 weeks, happens approximately 4 times in every 1,000 births. I think that might be the most shocking statistic of all of these, because I think in 2025, why are babies still dying? And what can we do to stop that? It's unlikely that we'll ever be able to stop it, which is incredibly sad. But we can support those who do go through with it. Neonatal death occurs in approximately every 3 in 1,000 births. This, again, why are 3 babies out of every 1,000? Why are they dying? And these are things that we need to look at and we need to consider. And behind those deaths are parents. Behind those deaths are other family members who are grieving the loss of a baby. Within these statistics, it can be argued that there are some demographics that do play a strong point in this. For example, it's been suggested within some research projects that those from deprived areas are more likely to experience loss, whilst infant mortality rates are much higher amongst Black and Asian ethnic groups, as well as maternal age as having a part of this. And I think these are the things that will be important when it comes to the inquiries that you receive, because these are the things that medical professionals might look at as an option or a reason for that loss. While some of these do appear to be relatively small numbers, 11 out of 1,000, 4 out of 1,000, 3 out of 1,000, the fact is that they're there. And it does mean that these families have experienced the worst thing likely to happen to them, and they will need some support in some way. And if we can get support in any way possible, we're going to grab it. So I've just popped these statistics. I'm really sorry, you might need to squint to look at these. It is quite small. These figures are all from 2021 to 2023. Statistics for 2023 to 2026, or 2024, sorry, to 2026 will be reported in 2027. They're normally done in conjunction with the Office of National Statistics, Tommy's, the Baby Loss Charity, and NHS Statistics via gov.uk. These are really, I've put some links in if you want to have a look at these in your own time, because they are very interesting to read. Please do. It will give you a really good insight. There is a report on the Office of National Statistics around the statistics around baby loss, and I think that is something that everybody can learn from. So moving on to why language matters. This is something that both myself and my husband we've experienced the good and the bad, and the bad is what sticks with us. Now, I'd love to say it's the good that sticks with us, but we all just expect to be treated with respect and kindness and compassion at all times, but particularly when support is needed. From an early age, we're all taught that our words have a lasting effect. Why should this change when we're discussing baby loss? It's likely that you've come across somebody within your life who has suffered a bereavement, whether that be a parent, a grandparent, a sibling, an aunt, an uncle, a friend. But it is normally someone of an older age. And I think we normally go, I'm really sorry to hear that. Is there anything that I can do? But would you know how to discuss someone's bereavement if they told you that they had lost their child? Whether that child was during pregnancy, whether it was birth and beyond, whether it was an older child, and would you know how to discuss with them? Would you know how to support them? And would you feel comfortable in supporting them? These conversations do require a little bit more care and a different approach to normal. As parents, losing a child, it's often said to be against the natural order of things. And so I think that's why people have this instant anxiety when it comes to talking to us about it. And one thing that we always say is that talking to us about it and talking to us openly and honestly, it won't remind us that our children died. What it actually does is remind us that our children lived and that they were once a part of our family and that they are still a part of our family and that they are a part of something bigger and that we can't forget that. We wouldn't talk about our living children in any other way other than with joy and happiness. So why should we talk about our children who are no longer here with any different tone or emotion? If you find yourself listening to somebody who is quite open and honest, or you might think that I'm going to have to coax a little bit of information out of them, the words that you use will help shape the journey of their grief. We often use the journey of grief as an analogy for the things that we go through, but it's different for everybody. And so you may need to adapt your conversation a little bit where necessary. Using the right language, it will massively assist in obtaining the parents' trust and allowing them to open up to you and provide you with the details that you will need to be able to progress with their potential case. Using the wrong language, I'm sure this is something that we're all worried about. And believe me, it's easy done. And I think we're all guilty of sometimes saying the wrong thing. I have one point or another, but it's important that we remember that that's likely what they're going to take away. It often invalidates the grief of the parent or parents, and it can add trauma and distress at an already difficult time. There are some words that we wouldn't use, and I will come on to those a little bit later on. In the way that we would remember negative care, as I'm sure many of you with your clinical negligence inquiries, you hear about negative care on a daily basis, all day, every day. We live that all day, every day. I could relay to anybody right now the start to finish of our care, every aspect of it, good and bad. But the thing that I would focus on more is the bad care and the negative care, because that's what's had the most profound impact on me. So the words that are used, they're also going to be what we remember. I often say time is a healer. It's one of those old wives' tales. In baby loss, that doesn't apply. Time is not a healer, it's something that we just learn to live with. So you might be speaking to a client who is very new in their grief journey, or maybe like me, who is 6 years in. But we still don't need a negative language to add to our trauma and distress. Clear and compassionate language is going to hugely help remove. There is still a stigma felt by us bereaved parents. We feel like we can't always talk about it. But when we are able to, and when we're given the platform to, that stigma is removed by our conversing person. We're able to use clear and compassionate language. Again, mirroring your language or mirroring our language is something that we probably won't even notice, but we'll notice that we haven't felt terrible. There's a lot of practical language to use, but if you are in doubt at any time, please ask us. We would much rather you ask how we would like the conversation to be led than not ask and get it wrong. So I'd like to give you a little bit of an example. I had a miscarriage at 16 weeks a couple of years ago, and having spoke to a professional about it, it wasn't somebody in the medical profession, but I was told that I would need to be induced and give birth. Whilst this is hugely different to a birth at full term, it was still labour and it was still birth. When discussing this with this professional, they said, "Why do you need to go through that? Do they not just cut it out of you?" That opened up a whole world for me that I thought did not exist. I thought that actually people would say, oh, I'm really sorry to hear about that. Is there anything that I can help you with? Please let me know how you are. It was a difficult conversation to have, both from my perspective and theirs, because the conversation instantly turned awkward. It instantly became an uncomfortable situation for both of us. And whilst we need sometimes blunt honesty, what we don't need is coldness and cruelty. And whilst it might seem like you are helping us by being honest, we need honest compassionately. Asking questions, personal questions, they might sometimes feel a little bit uncomfortable, but once you've asked them, the whole conversation is likely to change. Personal questions such as the baby's name. Does your baby have a name that you would like me to use? This could be initials, it could be a surname, it could be a nickname. Through the football team, we have heard every name, I think, possible. We have Baby Cloud, we have Baby M, or we have Poppy and Dotty. Using their names, it validates them as a person. It shows that they existed and that they still exist in our capacity, in our family. Asking if the parents have a preferred term to describe their loss. I personally, I do not like the term miscarriage when referring to the birth of Poppy and Dotty. I went through hours of labour. I went through a traumatic birth. I went through postnatal recovery. But legally and medically, they are still referred to as a miscarriage. And this is something that I struggle with in conversation. But asking these questions, it can help build a relationship between yourself, between the parents and the other family members that might be involved in these claims. But it will also allow you to see that behind these claims, there's a real person, there's a real family, and there's a baby at the centre of it. Using a preferred term for loss is hugely important. I think it's also important to advise parents gently that within any medical reports that they might receive as a result of this inquiry that they've brought forward, the medical terminology will be used. It probably won't be their preferred term. So whilst we don't have a claim to bring forward, if we were to, I would fully expect that the terms stillbirth would not be used to represent the loss of our twins. It would be a miscarriage because we were 12 hours short of 24 weeks. It is something that a lot of parents do struggle with, and that's why asking is incredibly important, because you will know then how you're going to lead this conversation. You'll know in future to refer to their loss as a stillbirth, as birth, or if they prefer the term miscarriage, you'll know to use miscarriage. By asking that at the start, you're already making such a progress with them. Appropriately mirroring the language that parents use, it can also be vital. If you are unsure of what to use, by listening to the parents, by opening up and asking them those questions that may feel a little bit uncomfortable, if you implement that in your own speech, already we're gonna trust you instantly, because you will be on the same wavelength as us. You will understand exactly what it is that we are referring to, and we'll think that you get it. Using person-centered language, also important. As you would with any, if you were speaking to your friend, to your family, use the same speech with us, whilst there is still the professional boundaries, but using kind and compassionate language, asking, how are you? Inviting them to take their time. Ask them if they want a cup of tea to ease in. All important things that, whilst little, they make such a difference in the way that this conversation is going to happen and is going to progress. And it's likely that things will move forward a little bit more quickly, because we will be able to open up a little bit easier to you. whilst language is incredibly important, and it might feel a lot of pressure to make sure that you are using the right language, it's important that we remember that it isn't just the mums behind these claims. We often see in healthcare that all of the conversations are aimed at mum or the birthing person, or they're aimed at the female within the couple. I can't stress enough how important it is to acknowledge the other partners and family members with the birthing person. It may be dad, it may be a same-sex partner, maybe a sister, a mum, a friend, but they have also lost and they are also grieving, and that will be in their own way. And it's incredibly important that they feel included too. So making sure that your language is inclusive of them and their grief and their feelings within any discussion, because they will want to be a pillar of support, but they will also need to be supported. And as I mentioned previously, my husband was one of those. He wanted to support me, but he needed lots of support too. And that wasn't directed at him, and which is why we had to create our own. Having knowledge of organisations who could provide additional support is also vital. And I have got a slide at the end of this with some incredible companies, charities, organisations who are able to provide a huge amount of signposting and make a massive difference to the support that bereaved parents get. This, if you were able to pop these in conversation, you know, if you have somebody who they don't know where to turn, something has happened within their birth, they've got some alleged claims and some alleged negligences, but they need some support in their personal life. These organisations can make such a huge change, and I have popped some of these on, so they'll be really important, and they have lots of training materials that hopefully will guide you in the right direction. There have been lots of use of research into the language that is used when talking to a bereaved parent, and unfortunately a lot of this is clinical. And so how can we pop this into conversation when discussing legal claims? As far as we are aware, there's only been one formal study, and that has been conducted by the University College of London. There have been lots of other little studies by charities, research projects, etc. But this is the only formal one that we are aware of. And it found that the majority of bereaved parents had heard terms that they found unacceptable when talking to professionals about their loss. As I mentioned earlier, a great term is miscarriage. A great example of that is miscarriage. It doesn't always represent somebody's situation well. If you have somebody who's coming to you with a claim and they've had what is considered a late miscarriage, but they feel that there were incidents that could have been avoided, or you know, they're upset that it's not classed as a stillbirth, please ask them how they would like it to be referred to. If they use the term stillbirth, please use the term stillbirth when talking to them. 83% of parents who experience a loss between 18 and 23 weeks gestation did not feel that miscarriage accurately represents their situation. And I can confidently say that I am within that 83% of people. So I just want to refer, I know I've said so many times, but asking is so important. There are some colder clinical terms that we don't always take well to. The main one that I've put down is death. It feels incredibly harsh and final, and I personally found it very difficult when months later we had to go to our inquest, although not a requirement because we did know the reason why Poppy and Dottie died, but it was a formality for the hospital trust that we were patients of. Using the word death over and over and over, it brought up fresh trauma for me. And so I find that softer language, such as passing, they're much easier to digest. Now, there are some words that I have discussed with my circle of friends who are also bereaved parents, and when it comes to the term stillbirth, they also don't like that. That is a difficult one. Some people will use the term born sleeping. Some people will use the term born silently. Again, asking and using the correct language and the preferred language by the parent is what's going to help you progress these conversations. And hopefully by using that language, the parents will feel that they're able to open up a bit more. You might see at the bottom of here, put using the word baby brought comfort to parents when discussing their loss with professionals. You might be thinking, what else would we use? Why would we not use the word baby when we're discussing cases around baby loss or pregnancy loss? Medically, often, and this is something that we find quite upsetting, particularly in losses prior to 24 weeks, baby will be referred to as fetus. And my least favourite of them all is product of conception. We refer to them as the 3 C's: clinical, cold, and cruel. A living child would never be referred to as a fetus, and a living child would never be referred to as a product of conception. So why are those terms still used for children who are no longer with us? Using the word baby, child, daughter, son, however the parent wants to refer to their child, that's the right way to do it. Again, listening for the language that the parents use, asking, does your daughter have a name? You know that you're going to refer to them as daughter. Things like that, they make a huge difference. Acceptable language to use. I've said all the way through this that asking is important. And you can never ask too many questions. I personally will never, ever get sick and tired of hearing people ask me questions about my children. Because why would I want to talk about my children? Some people find it difficult, of course they do, but why would I not want to talk about them? If the right questions are asked, of course I'll talk about them. Using humanising language. So using a baby's given name and gender, as we previously mentioned. There was quite a big campaign a few years ago in which a number of parents, which we were proudly part of, created the Say Their Name campaign. This was advising all people from all walks of life that using our babies' names, it won't upset us. It actually reminds us that although they're no longer here, we're never going to forget that. But in fact, using their names reminds us that they were here, even if only for a moment, and that they're still thought of. If we can get that in any legal inquiries, I think that actually humanises it. It puts a person right at the centre of it. By giving a baby a name and by using baby's name within those inquiries, it makes it feel real, because it is real and there's a real family behind it. Using softer language, again, this is going to be something that you'll find out when you talk to the parents, but if you follow their lead, if you mirror their language and use their preferred terms, we'll feel listened to and we'll feel validated, and it won't feel as though we're in a clinical, formal setting. We need warmth, we need comfort, we need essentially a big hug at all times. And those right words, those comforting words, those warm words, they're going to be that hug that we need. As well as the language that you can use, the body language that you use is so important. Eye contact is huge. One thing that we often find when we're talking to professionals about our losses, regardless of what profession they're in, eye contact is so important. If you're not looking at me, I feel like you're not listening to me. And if you're not listening to me, how can you support me? If you're sat formally, rigid and upright, I feel as if I'm in the head teacher's office. So providing all of these things in a softer manner by being someone's friend. You know, if you're talking to the parents as if they're your friend, as if they were somebody that you were comforting in your personal life, then absolutely we're going to feel much more comfortable in your presence, and we're going to feel much more comfortable discussing our children with you. As discussed earlier on, these are some of the incredible organisations who can help provide additional support where it might be necessary. There are some fabulous organisations who make huge differences to the way that bereaved parents are heard, the way that they're listened to, and they provide support. They also provide support for professionals. So whilst I hope that the things that I have discussed with you today have been valuable to you and have provided a little bit more of an insight into the life of a bereaved parent, if you do need some additional information, please feel free to look at some. They have some incredible things. So just to finish off from myself, there are a couple of ways in which you can contribute. Every year we are part of the alliance with SANS charity. Businesses are encouraged to get involved in Baby Loss Awareness Week every year. That is happening right now, the 9th to the 15th of October. It's always encouraged if brands can turn their social media, their branding pink and blue. It's a small token, but it is something that we love to see. We absolutely feel so much comfort in it because baby loss is still a difficult subject. It's still not talked about enough. It's not taught in schools. And shockingly, for midwives, it's not an official part of the curriculum. And so by spreading the word of it wherever we can, is going to make such a difference. I'd also like to share the mission of Angels United with you. I've popped the link to their website at the bottom so you can find some more, but we would love it if you could share us around your network. We could provide valuable bereavement support to somebody who might need it or who might not even know that things like this exist. If you would like to hear more about how we can tailor the support to you or within your network, I'd be more than happy to discuss it with you at a later date or after this training session. We can offer bespoke training sessions for you and your team, whether that is something that you feel would be beneficial. If you do deal with a lot of inquiries that deal with birth injury, pregnancy loss, neonatal loss and beyond, I'd be more than happy to discuss that further with you. Thank you very much for your time. It has been great to be able to share my experiences with you, and I hope it's been valuable.
Thank you so much, Katie. That was really, really insightful. And I also just want to say thank you for being so open and sharing such a deeply personal experience with us. So thank you so much. Before we move over to the Q&A, I just want to give you guys a quick reminder of our next webinar we've got coming up on Thursday, the 23rd of October, all around birth, injury and obstetric decision making. We're going to be joined by Dr. Lorna Felon, who's a consultant obstetrician and gynecologist. So we'll drop the registration link in the chat now, and also it will be included in some follow-up emails after the event. So moving on to the Q&A, I actually have a question myself to get us started. When a bereaved parent avoids discussing the details of their loss, how can a solicitor sensitively gather that information that they need to progress the case?
Yeah, I think it's, unfortunately, it probably is going to be something that solicitors do come across at some point or another. You're either going to have parents on one end of the spectrum, they're going to really want to open up and talk about that loss, and they're going to be, I hate to say, they're going to be the easier conversations to have because you're probably going to get everything with minimal input. But there will be some parents who know that they need to speak to somebody, but they don't know the words to do that. Taking it slowly is so important. If we're rushed, we'll forget things. We might feel like we're not getting our point across correctly. So, asking those questions that I mentioned earlier. Does your baby have a name that you'd like me to use?
Yeah.
Is there a term that you'd like me to use? If you can use open-ended questions rather than closed questions that just require a yes or no, you're going to get a little bit further. Questions that actually require a thought answer, they're going to be the ones that are that are helpful to you. It might take some time, but if you can just keep trying to obtain that trust by just being warm and human, you'll get there eventually.
Okay, brilliant. Thank you so much. And we also had a question emailed in earlier today from Victoria Johnson from Pennington's Law. She has asked, I work a lot with clients who have either lost babies or whose children have been severely injured at birth. I'm pregnant myself and wondering how best to mention this to these clients when the time comes to let them know I'm off on maternity leave. Most of our meetings are via Zoom or on the phone, so they won't know until I tell them.
It's a really, really good question. And it is something that I've been asked similar before with friends and family members. And the way that I always explain how I would prefer to find out about a pregnancy. It can be difficult as a bereaved parent to hear of someone else's pregnancy for a couple of reasons. One, we're incredibly happy for you. We're always happy for you, and we're never not happy. But we're always sad for ourselves, and that it does take a little bit of time to sort of get to grips with. So if it was a friend or a family member who I've had this conversation with in the past, I've always advised, please don't ever blindside the person. Please don't just drop it on them, because we need to handle it in our own way, and sometimes that needs to be done in private. So I have advised other people in the past to send a text, I just wanted to let you know that I am pregnant, and I understand that this could be difficult news for you to hear. Obviously, within the profession, a text probably wouldn't be appropriate, but maybe a friendly email, and if you could just pop that over, allow them to have the time that they need, and then at your next meeting, maybe just gently bring it up and say, I'm just checking that you got my email, just so that you're aware I'm going on maternity leave. I understand it could be difficult for you to hear, but whilst I'm on leave, I'll ensure that the transition is smooth and that the person who will be looking after this in your absence is fully clued up on everything, because the parents will probably be likely worried that they're going to have to go through every single thing again and bring up maybe some trauma again. So if they've got time to prepare for that, great. And I think for me, that's the best way that I would prefer to find out.
Okay, brilliant. Thank you so much, Katie. We've also had a question from Vanessa. How can solicitors show compassion and understanding while maintaining the professional objectivity needed for medical legal reporting and litigation?
Yeah, I think, again, a really good question. We, as a bereaved parents, I use the term we a lot, but we are sort of a community. But I think bereaved parents would be looking at you for the knowledge that you can share. It's highly unlikely that they're going to have any sort of legal knowledge, and they're not going to understand the terminology. And so I think if they feel they can ask you questions about the medical side, the legal medical side of things, and the work that you will be doing, while still receiving those soft and warm questions. If you start with those questions asking how they would like this conversation to go, the name of their baby, etc., it should be easy then to bring in the professionalism, because it's like, I have had people before who have said, I just wanted to cry. When you say that, I don't know how you can talk about it without crying. And the reality is that we can, and it's sad for us, and it's sad for people to hear our story. Quite often people do get upset and cry. That's actually okay, and I don't want anyone to think that by showing emotion that's not professional, because actually by you showing some emotion to us, it means that you've heard us and you've understood what we were talking about and what we're trying to get across to you. But if you can also be knowledgeable about this inquiry that we're going to go through, you've already brought in the professionalism. You've already done both sides of it.
Thank you, Katie. And I think that ties quite nicely into our final question for today, which is if a client becomes emotional or distressed during an instruction meeting, what's the best way for a solicitor to respond in that moment without overstepping professional boundaries?
Yeah, and again, it's something that it's likely going to happen. It's a highly emotive subject for everybody involved. I'm able now, 6 years in, to talk about this almost without crying. 6 years ago, I wouldn't have been able to do this without a huge box of tissue by me. But just ensuring that you're prepared, have tissues to hand. Offer somebody a cup of tea. A cup of tea fixes everything, doesn't it? But offer them a cup of tea, offer them a glass of water, tell them to take their time. Being rushed, it's just, it adds to trauma. And I know it might sound silly that rushing adds to trauma, but if we can take it at a slow pace, then that's going to make a difference. If somebody does get emotional and distressed, if you can have, I know not everybody's going to have this facility, but if you have like a little seating area or somewhere where they can just be a little comfortable and take 5 minutes, sometimes that's all we need, just 5 minutes to get it out of our system and continue. You'll be surprised at how resilient bereaved parents can be.
Thank you so much, Katie. And thank you to everyone that attended today. I'd just like to make you aware that a recording of this session will be made available via email. And we look forward to seeing you at our next event. Thank you, everyone. Have a great afternoon.
Thank you.
Thank you.